Ibuprofen is a common over-the-counter medication that a lot of patients are going to be using to treat moderate pain and different inflammatory states. Trade names are Advil and Motrin, so you've definitely seen this medication. You can just walk into any pharmacy, any grocery store, any gas station, and buy ibuprofen. Let's talk about what it does and what the indications are for it. First of all, ibuprofen is an antipyretic, antirheumatic, non-opioid analgesic, and an NSAID. What does NSAID mean? It means nonsteroidal anti-inflammatory agent. So NSAID, nonsteroidal anti-inflammatory. So the reason we give these medications is they actually help to decrease pain and inflammation by inhibiting prostaglandins. So what we have in our bodies, we have these prostaglandins. Whenever we get injured, whenever something happens, we release these prostaglandins, and this will raise our temperature. This is going to make us feel pain. And so what NSAIDs do, ibuprofen, for example, what it does is it goes and it inhibits prostaglandin synthesis. And this is going to help prevent us from feeling pain. It's going to help bring down our fever. And its pharmacologic class is non-opioid analgesic. So it can be used in conjunction with other opioids and things to help to treat pain. It can also be used in place of for mild pain. There are some really important things to keep in mind here. One of the biggest things to keep in mind is this can cause GI bleeding. So we want to monitor our patients, monitor for any signs of bleeding, any bloody stool or anything like that that would be a sign of a GI bleed. It can also cause hepatitis and Stevens-Johnson syndrome. Some patients will develop anaphylactic reactions to ibuprofen. So you want to ask your patient, have they ever had any sort of reaction to this? Have they ever had any skin rash or anything happen after taking ibuprofen? And be careful that we don't give it if that is the case. We want to monitor for headache, nausea, vomiting, constipation. And patients that are taking ibuprofen should avoid using any alcohol while they're taking it. It can cause a disulfiram-like reaction if they take it with ibuprofen. One thing that this can be used for as well is, pediatric patients can develop Reyes syndrome if they take Tylenol, if they take too much Tylenol or Tylenol for a viral reaction. So what can be done here is parents can alternate ibuprofen and Tylenol for babies, and that helps to limit how much Tylenol the baby actually gets. And so you could give a dose of ibuprofen, wait a few hours, give Tylenol, dose of ibuprofen, and alternate it like that to make sure the baby isn't getting more Tylenol than what they should. So this is a very common medication. It's something you really do need to know just because so many people take it and we don't really understand it. I don't think, the lay person, the non-medical person is going to understand some of the indications with this GI bleeding, the need to avoid alcohol, and then just understanding how it works, inhibiting prostaglandins. So that is ibuprofen, and that's what you need to know. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.